1 in 5 adults, they experience mental illness, often remaining undetected in community. What is the delay? Average gap between symptoms onset and the patient reaches to a psychiatrist or to any mental health care. It is around 11 years of delay. So what is the future of mental health in primary care? AI-powered screening is there. So machine learning algorithms for early detection and risk prediction and personality assessment are knocking our doors. Mobile health app is available. Patient self-monitoring tools, psychoeducation modules, and symptom tracking is available. Community health worker, trained frontline workers supporting mental health awareness and outreach program is there.
Believe it or not, doctors are one of the highest ranking stress-prone professionals because of their work pattern. And because we are dealing with human, and managing stress does not mean removing stress from your life. That's never going to be the right way of handling stress. But it is an art to maintain it to a comfortable level for optimum performance.
Hello, thank you for tuning in. If you want to come back to this video later, just tap on the like button. It will save it to your liked videos so it's easier to find. And don't forget to hit on the bell icon to get notified whenever we drop new content. Stay curious, keep learning, and see you on the inside.
Hello, everyone, and welcome to today's session on the World Mental Health Day. And on this occasion of 10th of October as the World Mental Health Day, we have arranged this session and organized this with the help of our three esteemed faculty to rethink mental health in our healthcare and drive attention from psychiatry as a specialist care only and include that in primary care as well. So we have with us our three speakers for the day. We have Dr. Himanshu Desai sir, we have Dr. Sandip Shah sir, and we would be joined by Dr. Archana ma'am for a session. So without further ado, I would welcome our moderator for the day, Dr. Himanshu Desai sir, and hand it over to him to continue this session. So we have three sessions lined up for today's day. And to start with the first one, we have a consultant psychiatrist, and he's a director at GIPS Psychiatric Hospital and the De-Addiction Center at Ahmedabad. He's also been a past president from 2011 to 2012 at the Gujarat Psychiatric Society. He's a visiting psychiatrist at the Sardar Patel De-Addiction Hospital run by the Gujarat Nashabandi Mandal, and also at the Apollo Hospitals in Ahmedabad. He's a founder and managing trustee of a registered NGO called UDAN Foundation, which is working in the field of de-addiction and mental health. Thank you, sir, for joining us today, and over to you.
Thank you, Sanika. Basically, today is World Mental Health Day, and basically we need to think about mental health care, which is very much important for almost all the practitioners. Today, I'll be talking about the role of primary care in mental health screening and early intervention, which is very much required. So, and I'm Himanshu. I'm practicing in Ahmedabad. So basically, there are lots of challenges, mental health challenges in primary care, because most of the time we during our curriculum we have not studied psychiatry well. Though out of 100 general population, 30 to 40 people are suffering from some or other mental disorder. In our clinical practice also, we are seeing many patients, along with them, that they are also having some or another mental health issues. If we touch them properly, then maybe our outcome in other specialty also changes, or maybe there will be better improvement. So basically, this is an invisible epidemic. 1 in 5 adults, they experience mental illness, often remaining undetected in community settings. 25 to 30% of consultations in general practice relate to mental health issues, often masked as physical symptoms. They come with lots of physical symptoms, but if you go deep into all the symptomatology, you'll find that there are some psychological part is also associated with that. If you do not touch to those things, then maybe his or her physical health is not responding as it has to be. What is the delay, average gap between symptoms onset and the patient reaches to a psychiatrist or to any mental health care? It is around 11 years of delay. So it is a huge gap. And maybe in India, when there is a lack of expert people, then it must be little longer also. So mental health symptoms often hide behind physical complaints. Patient goes to gastroenterologist, patient goes to gynecologist, they go to orthopedic surgeon, they go to general practitioners because their complaints are sometimes vague complaints. And the doctor tries to give any symptomatic treatment, but patient do not recover because there this behind these physical symptoms there is some psychological issues are there. So recognizing these invisible signs is the first step towards healing of these people. So why primary care matters? Why a primary care is very much important. Primary caregivers are very much important because they are the first point contacts. So most patients seek help from their trusted family doctor first, and they have a very trusted relationship because they have a long-term rapport, and early detection and open conversations is very much common with these doctors because they are family physicians. They know them well, they know the whole family well, so the relationship is definitely much deeper with primary care physicians and the patients. And holistic integration is very much required because there is an opportunity to unite mental and physical health care seamlessly with this factor. And what is the cost of missed mental health diagnosis? When we misses the diagnosis of mental health issues, then it has a huge cost. So the first is worsening physical health. Untreated mental illness leads to deteriorating physical health outcome and chronic diseases. Social and economic impact is huge. Lost productivity, relationship breakdown, and reduced quality of life for patients and families is very much seen. There is an increased burden of hospitalization and emergency visit and overall healthcare expenditure because of when we misses a proper, genuine mental health diagnosis or disease. So, what is the gateway for early intervention? Is the screening of these people. So, what is the mental health screening? It's a brief, standardized tools are available, which is required for quick assessment to identify early symptoms of mental health conditions, and which focus on the common disorders. We don't want to go to whole psychiatry, but if you can diagnose common disorders like depression, anxiety, psychosis, substance use, then maybe half of your job is done. So these are the most prevalent conditions in primary care. And if you do timely action is done, then facilitates prompt referral and treatment initiation before condition become worst. So these are some of the tools which are evidence-based screening tools for primary care. One is PHQ-9, which you can easily administer. Basically, it's a patient health questionnaire, which is a gold standard. There are 9 items are there. You can Google on the net, and you'll get this questionnaire. You can use this questionnaire for your general clinical practice, which will give us this is a tool for depression screening and severity assessment. Similarly, GAD is Generalized Anxiety Disorder Scale, which is also good. Audit is for alcohol use disorder identification test, which is developed by WHO, which you can use for your patients who are taking alcohol. Then SIBRIT model, which is screening, brief intervention, and referral to the treatment. So this model is very much important. And if you follow this, then definitely your outcome will be much better, which is comprehensive framework for substance use. So screening in practice, 90% plus countries, they are using all these things like PHQ-9 is validated and used globally across diverse populations and settings. 40% changes will be seen in quality of life and improvement. Early screening linked to a better outcome and reduced complications. More than 20% is current screening rate is there. So despite evidence, screening remains very low in primary care. So most of the people are not screening these patients. And if you miss all these things, then there are lots of other complications. So if you start screening these patients, then definitely the outcome will be much better. So what are the barriers in screening in primary care? Most of the time people are saying that I have a heavy OPD and it's very difficult for me to screen these patients because I have a limited time. So time constraint is the major thing. So limited consultation duration makes comprehensive screening more challenging. Resources are limited. There is a weak referral pathway and insufficient integrated care infrastructure is there. There is a training gap. Many primary care physicians lack of formal mental health assessment because during our MBBS days we have hardly read at least 2-3 short notes, not more than that. I think if we have a full paper of 50 marks or 100 marks in our medical curriculum, then it would be very good for the future generation. There is a lot of stigma associated with mental illnesses and reluctance. So patients are hesitant, and there is a cultural barriers are also there for mental health discussion. Early intervention, and which is a changing trajectory. Timely assessment and management is very much required. So prompt action after positive screening results, brief counseling and psychoeducation, lifestyle modification and self-care strategies, medication when clinically indicated, and specialist referral for complex cases can be done. So what are the goals? To prevent progression, to serve severe illness and disability through early targeted support. This is SIBRIT approach is screening. So identify risk level using validated tools, brief intervention, and referral to the treatment is very much important. And this approach helps a lot for taking a patient to the right thing. So real world impact. There is a good study has been done. 100,000 plus patients were screened, and between 2021 to 2023 across multiple settings. In alcohol, the abstinence was increased a lot, and there was improved functioning was there. So early intervention through SIBRIT has transformed life, preventing progression to serve addiction and mental health crisis. What is in Indian context? Integrating mental health into primary care. So growing burden, 14% of prevalence of mental health illness in India. Over 190 million people are affected. Only 0.3 psychiatrists per 1 lakh population is there. So there is a severe treatment gap. So primary care is the solution. So scalable model for early detection and management across urban and rural area is very much required. Sarika, can I go ahead? Can we have some question and answer, something?
Yes, sir. Yes, sir.
At least 2-3?
Yes, sir, we can.
So there is some poll for the viewers. You can go through the poll.
I'll start with the first one, sir.
Yes. You can answer the questions. How important is the role of primary care provider in identifying mental health issues? Very important, moderately important, not important, or unsure? You can answer. Right. So 91% people, they have said that it's very much important for the primary care providers in identifying mental health issue in the early phase of the time. Some of them have said it's not moderately important or not important. No one has said not important. So definitely it is very much important. Can I have another poll question?
Yes, sir.
Do you agree with the statement that brief counseling and educational support from primary care providers can meaningfully improve patients' mental health outcome? So strongly agree. Brief counseling and educational support by primary care providers has definite role in patients to improve patients' mental health outcome. Thank you. Can I have a third one?
Yes. Just, it will take some time to close.
Fine.
Yes. And in the third one right now.
Which factor most limits effective mental health screening in primary care setting? Lack of time, limited training, lack of access to referral service, and stigma. So 42% of people say that there is a lack of time, and there's a 33% says that it's a limited training. Stigma is among patients. Okay, so we'll have to work together to remove the stigma. I think lack of time is not the answer, but limited training is definitely the answer, because time we can shorten the time by using some of the tools. We'll talk about those things. So practical steps for primary care providers. So choose validated tool. You can use the tools which I have discussed, like PHQ, general health questionnaire. You can use all those tools to reduce the time. Then integrate into routine care. Incorporate screening into regular checkups, chronic disease visits, or health assessments. So if you regularly use all those questionnaire, then definitely then you can easily pick up the mental health issues. Leverage technology. Use digital platforms, tablet-based forms, or simple paper questionnaire, which can be quite useful. When people are waiting in the waiting room, you can use this paper pen kind of questionnaire, and you can pick up the mental health issues from those questionnaires. Create follow-up systems. Establish clear protocol for positive screening and referral pathway. Enhancing skill, what we can do. So professional development, training in mental health assessment technique can be used. Communication skills for sensitive discussions can be done. Brief motivational interviewing method should be useful. Cultural competency in mental health care can be done. So building a network is, again, this is what we can do for professional development. For building network, map a local mental health resources, whichever is available. There are lots of government medical colleges, and mental health professionals are also there. So establish a referral relationship. Join a peer learning group. Like this Medflix is a platform where you can learn lot many techniques and skills also, and improve your knowledge. Access online training module, which is there available on Medflix also. So collaborative care model is very much important. So where there is a role of primary care physicians for screening, initial assessment, and basic management. You can have a care manager for follow-up and monitoring and continuity of care. Social workers can be of a good use for coordination, resources, and family support. And mental health experts are there for complex cases and medication management and consultants. So evidence shows that a team-based collaborative care leads to better patient outcome and higher satisfaction and improve recovery rate. So overcoming stigma is again very much required for building trust. So what you can do, integrate mental health questionnaires naturally into all consultations. So whenever a patient comes, you can definitely ask them that how is your mood, how is your sleep, how is your appetite. These general questions may give us some idea that he or she might be suffering from some or other illness. So if we can include these questions in almost all consultations, how is your mood? A simple one question can be of a very good use. Any history of crying spells, mood, these simple questions will definitely pick up depressions or anxiety kind of things. So another thing is empathetic communication. Use active listening, non-judgmental language, and validate patient experience without stigma. Educate patients and families about mental health conditions, treatment effectiveness, and recovery possibilities. Because there are lots of stigma is around across in the society about mental health issues, mental health disorders, mental health treatment, even about the medications. That the medications for mental health are sleeping pills. The treatment for mental health is addictive. No, these are myths. Primary care physicians definitely be of a good help to remove such stigma, such myths. So policy and system level support. According to Indian mental health care, supportive community-based care and integration of mental health services at primary level, even national guideline is there for this. WHO has also given guideline. US committee has also given such recommendation. You can use digital system. You can use telepsychiatry to improve mental health of community and the society. DMHP is a program which was started in 2016. The training of primary care doctors were done, then implementation is done. So results are quite very good. So DMHP demonstrate how systematically training and support can transform primary care into an effective mental health delivery platform. So it is very good. So what is the future of mental health in primary care? AI-powered screening is there. So machine learning algorithms for early detection and risk prediction and personality assessment are knocking our doors. Mobile health app is available. Patient self-monitoring tools, psychoeducation modules, and symptom tracking is available. Community health worker, trained frontline workers supporting mental health awareness and outreach program is there. So call to action for primary care. आप क्या कर सकते हैं? So make a screening a routine habit. Integrate a mental health screening into every practice as a standard care for all patients. Advocate for resources and collaborate with specialists. Together, we can change lives through early mental health care. Every screening is an opportunity. Every conversation matters. Every referral saves a life. So primary care is a frontline of mental health. Early screening saves life. Primary care provides and primary care providers lead change. Let's commit together, integrate mental health into everyday practice for a healthier and more compassionate India. Thank you very much. If you have any questions, you can write down. Later on, we'll answer all your questions. Hi friends, our other speaker is Dr. Sandip Shah. He is professor and head of the Department of Psychiatry, GMERS Medical College, Gothri, Vadodara, since 2015. He was an ex-dean at GMERS Medical College at Godhra. He was an additional medical superintendent at GMERS Hospital, Gothri. He has a total 30 years of experience in the field of psychiatry. Academic affiliation like International Medical Advisor, Minds Foundation USA, Global Mental Health Program Supervisor, Mount Sinai School of Medicine, New York, USA. He is a research collaboration, has completed 4 international and 10 national research projects. He has lots of research publications, like 72 international and national publications in reputed journals, and has approximately 2,500 citations. Dr. Sandip Shah, over to you. And most important thing is he's one of the very good friend of mine since almost 30 years.
Yeah, Dr. Himanshu, thank you for the vivid introduction. And I request Seneca to, okay, will I have, yes, okay. So I'm going to talk on physician burnout or how to manage burnout. As all of us are aware, mental health is one of the most important factors, aspects of our day-to-day life. And we should look at that life. We should look at our mental health issues, and we should try and know if we are facing any issues because of the stress which we are not able to cope properly. Adequate coping with stress is one thing which, as physicians, all of us should develop so that we do not have long-term mental health related issues because of inadequate coping or faulty coping. Here is a definition that helping professionals affects anyone, career-driven, overworked, celebrities, homemakers. It is a syndrome of emotional and physical exhaustion, alienation from work like detachment, sometimes cynical or numb, reduced performance, hard to concentrate and lack of productivity. So stress, these are all the new age killers. Comparison of leading causes of death and disability worldwide from 2020 to 1990, you will see that one of the leading cause of morbidity, depression, stands third in the WHO line. So it's not synonymous to worry. Our body has broader definitions of stress, and it is synonymous with change, good bad or imagined change. Whenever the change is good, it produces eustress. But whenever the change is bad, which we do not like, then it can cause distress. And similarly, imagined change is usually responsible for anxiety. Most people are exposed to such much higher levels of stress than they realize. It's difficult. I would not understand if I'm exposed to stress, but I would see such behaviors around me. And one of the commonest reasons are we are at high risk depending upon certain factors like personality, environment, heredity, and others. Multitasking, as you can see in this figure here, she's trying to cope with all of the things and also drinking tea, thinking that that's going to de-stress her. Believe it or not, doctors are one of the highest ranking stress prone professionals because of their work pattern and because we are dealing with human and his or life directly. So expectations of our family members we have to match, our own expectations we have to exceed, and also we have to match the expectations of people with whom we deal with. These are few reasons why stress and then stress leading to burnout happens, like lack of control over schedule, assignments, targets, resources, unclear job expectations, dysfunctional workplace dynamics, extremes of activity, lack of social support, work life imbalance, dysfunctional family life, poor habits, genetics, neurobiology. Unshared responsibility: 20% are stress producers, 40% are semi stress producers, 25% are neutral, and 15% are soothers. These are some of the physical, emotional, and behavioral manifestations of stress. And these are the stages of burnout, which stage 1 is honeymoon stage, stage 2 is balancing act, stage 3 is chronic stress, stage 4 is burnout, and stage 5 is habitual burnout. The honeymoon stage, when it's a newly wedded wife and she tries to please everyone in the joint family, the husband, the mother-in-law, the father-in-law, sister-in-law, brother-in-law, and finds it hard to say no to anyone, tries to cope with all the responsibilities he or she is given, is the honeymoon phase. After that, they start realizing that it's becoming difficult to say yes to everything. And then coping becomes difficult. And then you start seeing the other stages of not being able to handle the stress properly. So these are the stages of burnout, as I have highlighted. The honeymoon phase is the first stage of burnout. And as the name suggests, this phase of burnout is similar to the early days of a romantic relationship. Eventually, the honeymoon phase dwindles and you begin to experience stress. So the onset of stress, if not handled properly, then it will lead to chronic stress. Habitual burnout usually seen or causing mental illnesses like depression, anxiety, and psychosomatic disorders. What is the hallmark of burnout? Feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficiency. Especially, it's not similar to a Monday morning blue when you may feel that, oh, kaam pe jana padega. It's more like, distancing oneself from the day-to-day activities which we do. Managing stress does not mean removing stress from your life. That's never going to be the right way of handling stress. But it is an art to maintain it to the comfortable level for optimum performance. And how to do it? We have to recognize stress, realize the stress causing factors, try to reverse it, and wherever not possible, build resilience against those factors which we cannot check. The phases of burnout are acknowledging that you are burnt out, distancing from stressors, focusing on self-care, reassessing priorities and goals, setting boundaries, seeking support, and making gradual changes. So you can turn to other people, reach out to those who actively listen to you, allow to ventilate, limit contact with negative people where possible, be more social with co-workers, join groups for meaning, cause, common interest, make new friends. And yes, power of giving. One of the major factors which can help people deal with the stress is that the feeling of someone saying thank you is also going to be very helpful to handle stress. Second is to reframe the way you look at stress causing factors. Be grateful, try to find some value in your work, change your attitude, find balance in your life, make friends at work, and take time off. Reevaluate your priorities. Set boundaries. Take a daily break from technologies, especially social media nowadays. Nourish our creative side. I will tell you, everyone should have one hobby. Try to pursue one hobby, especially one which has some physical involvement, and it will help you very much to at least protect you from the negative symptoms and negative effects of stress. And adequate sleep is also very important factor because that helps you to recuperate. Coping is of different kinds. The easiest one is emotion focused coping, where you can identify and be aware of negative symptoms and then take some time to identify the triggers for these feelings. Like, is it the person, the situation, the experience, the event, result, past memories, bodily complaints, etc. Most of the time, if you see in day-to-day practice, you will see that people are going back to the old 10, 20, 30 years back, where they had struggles, they had problems, they felt they are maltreated, and they keep on going there rather than enjoying what it is today. So it's important that we understand and start living in the present moment. And unfortunately, medical curriculum doesn't teach one how to live. It teaches so many other things about disorders and illnesses, but it doesn't teach how you should live life so that you can enjoy it the most. CBT is one of the ways where it tries to a certain extent, help people understand how to live life and what are the problem behaviors or problem thoughts that they are having. Like, there is an event or a situation or an experience or people, all of them can causing the stress. The emotions and feelings or physical sensations, the automatic thoughts, core beliefs or assumptions, and action, behavior or response. So all of them are interacting. All of them can be at any phase. But if we can handle those things, then yes, definitely we can handle stress in a better way. The other way of handling is the downward arrow therapy, where we can teach people to do some problem focused coping, like, what is the problem, change it or challenge it. If I cannot change or modify it, then emotion focused coping, to understand that this problem is going to be with me, or accept and adapt it, or yes, it is the right time to do something about it and take steps to initiate a change. So this is how, rather than sitting on a problem, it is very important to just plan and then go ahead. Similarly, time management. Most of the time, we are running around trying to meet everyone's needs, and it's really quite difficult. So, we need to understand that we also need to organize our time. There are certain urgent things and certain non urgent things. These are 2 by 2 table, which all of you are aware of, like in the statistics. The urgent things, and if it is not important, you can delegate this where possible. If it is important, get this completed now. Non-urgent and non-important, why are you even thinking about it, or why are you doing it? Not urgent and important, you can plan this before it becomes urgent, so that sometimes you can solve those things before they start causing stress. Some ways of coping with stress, as I told you, physically, there is a lot of literature which suggests that exercise itself, daily exercise, takes away a lot of stress and keeps you physically and mentally fit. Relaxation techniques, there are a lot of relaxation techniques in our spiritual books, in our culture. For so many thousands of years, people have been talking of breathing practices. A simple way of understanding the breathing techniques is that with any emotional change in our mind, in our system, there will be a change in our breathing. If you are angry, you are breathing hard. But if you can just breathe properly, just practice deep breathing and continuously breathe like that for the whole day, it will take care of the negative emotions which the stress can be causing. Social media, like I told you, today's day, social media is a very important aspect that we should control. Nobody can say that I am not going to see anything on the screen, but you can use it in a controlled manner and consciously. Don't make assumptions or comparisons. Most of the soap operas show so many things which people start believing are real in the society, and then they start causing problems. Don't follow or believe rumors. Use for your personal and social growth, and make sure it is not the only way to reduce boredom or loneliness. Develop other alternatives. See it to enjoy it. Then The untreated stress would lead to common mental health problems like the anxiety disorders, panic disorders, social anxiety disorder, generalized anxiety disorder, and most of them would be presenting with symptoms which do not have underlying investigations, which are positive, but the person feels that he or she is really having a big problem. Phobias and psychosomatic disorders. As Dr. Himanshu earlier told, depression, one of the commonest mental health problem which world is facing today, and very easily treatable if treated on time. It takes less man hours to treat, and the person becomes healthy earlier. It's important to diagnose depression by just asking about mood. You can just start asking people, how is your mood? And if the person starts crying or says, I'm feeling low all the time, then is the time to try and diagnose other things. Obsessive compulsive disorders, again, underlying thing is anxiety. And this is really difficult to treat and should be treated by mental health specialists. The biggest problem, the vicious cycle, is substance addiction. Substances, and most commonly what we see, is tobacco and alcohol. Alcohol is a CNS depressant. So many a times when a person is very anxious, doesn't or cannot sleep, has so many problems to face as per his own thinking, then he takes recourse in alcohol. And he is looking at alcohol for getting some sleep, feeling less anxious, and he will definitely feel like that. But then next day when he wakes up, again the problem is there, and he again goes to alcohol. So that is the way how a misuse or an abuse of drug or alcohol starts happening, and then he becomes dependent. And then he has all the more problems and complications, and he's having one more problem to handle than getting better from the problems which he tried to handle earlier. How can we help others? It is very important that most of the people, most 99.99% believe that I don't have any weak mind, I am very strong. But it is not actually weakness or weak personality when you have to seek help of a mental health professional. It is not just a bad luck or not suffering from old sins. So offer help, provide them support, and spend time with them. Show empathy towards other human beings for their sufferings, and actively listen to them before giving advice and suggestions. 100% try and be non-judgmental. Some myths, like Dr. Himanshu told about antidepressants and anti-anxiety drugs, most of the time people believe that they are sleeping medicines. This can cause addiction or dependence. Medicines need to be continued for lifetime, and medicines have serious side effects. But that is not true. Most of the times they are having multiple other properties, like for all of us who are practitioners, paracetamol can be given for body ache, it can be given for headache, it can be given for throbbing pain, for fever. So there are one drug which has multiple uses. Similarly, there will be so many things which will improve because of the medication, and not that they are going to put you to sleep. Apart from medication, structured counseling through psychotherapy is also a very helpful way of managing stress. So it is time to get yourself together, fix what can be fixed, improve your thoughts, read more books, indulge in self development, work on your moods, get stronger and healthier, work on yourself, work on your happiness, be full of self love, improve on your weaknesses, be comfortable about growth, outgrow yourself, and be who you are meant to be. I always try to end by saying that learn to say no, because that is one thing which we miss out while during our training, during our residency, during our practice. We find it very difficult to say no, that this is not my area of work. The time you learn to say no, it will become easier for you to cope with so many things. Thank you.
Thank you, Dr. Sandip, for lucid talk about the stress in the doctor's life. And the main reason you mentioned that it's a many time comparison, and we do not have much hobbies, and we are not using the techniques. And if we start using techniques like down arrow and time management, that can be of a good help. So if you can start working on yourself, that would be very good. And you should believe in yourself that what you are supposed to do. And there are certain techniques which you learn about how to help a mental health people, then definitely it can be of a good help. Sarika will take questions later on. What do you say?
Okay, sir. All questions together at the end is also.
Okay, okay. Then Dr. Archana is there, I think. Can we have our third speaker is Dr. Archana Javadekar. She is a professor at DY Patil Medical College, Pune, and she has an extensive teaching experience of over 22 years in medical education. And she has served at both BJ Government Medical College and Dr. D.Y. Patil Medical College as assistant professor to professor. She has published 12 research papers in the last 5 years, including 3 international and 9 national journal publications. She is a recipient of the Dr. G.C. Boral Award for the best paper on job stress in industry in NCIP in ANCAPI 2021. She is awarded by the Lakshmi Shanti Award for the best research paper by a female member of AIPI in NSAPI 2021 conferences. Over to Dr. Archana Javadekar, madam.
Thank you for the introduction, sir. It is nice and it is my pleasure to be here today. My today's topic is modern stressors, social media, technology, and substances. Good evening. You must have heard the lectures by 2 other professors, and it was very interesting. I think they have covered so many things of my topic that most of the things are already told by both the sirs. We will be discussing about the modern day stressors, because stressors have changed in the lifestyle and we have going through a different kind of world these days. So I will be talking about the kind of stress we face in the medical world today. As doctors, our lives have changed drastically and we deal less with the physical hardships nowadays and more with the emotional, digital, and social pressures. In this talk, we will look at how the social media, technology, and substances act as the modern day stressors, both for us and for our patients also and our family members. You have heard about the stress, I think, and burnout also. It is already covered. I will tell you in the short, like stress is the body or mind's reaction to the demands. And when then demands are very excessive or when they exceed our capacity, it leads to, and when it is difficult to cope, then it becomes a stress. A bit of stress is useful and it is required also. Like when you are appearing for any exam, you have to work continuously, you have to keep on performing so that you can do the better in your performance and you can improve your performance. A bit of stress is usually required for life, and when there is a stress there is a growth. So for growth it is very essential. When it is for a short period of time, when there is end, when you know that it is going to end soon, then it is considered as eustress because it leads to positive outcome. But when it goes beyond a capacity and when it starts draining you, it becomes distress, and distress is not good. When a doctor has a continuous OPD, ward rounds, continuously you have to keep on writing notes or talking to patients, there are calls from the patients, all without a rest. Then the body goes into a stress which becomes a chronic stress, and chronic stress usually leads to a lot of internal changes, and it leads to changes in the HP axis. It leads to release of cortisol level and it becomes very difficult for the body to handle. It has an effect on cardiovascular system, health, general well-being, immune system, and it also causes fatigue, irritability, and mental health issues. So this leads to increase in the prevalence of anxiety, burnout that you have already heard, and it leads to substance use also. Today we will talk, I will be talking about the social media as a stressor. In earlier times, people used to stress from the people used to face the stress from the survival issues like finding the food or safety that were important because that was the basic needs and they were not getting fulfilled. So initial days in early human life, there was the problems of basic security. Shelter was also very important problem, and people used to have difficulty in finding shelter and initial periods of life. But now we are dealing with a stress which is psychosocial stress. This psychosocial stress is especially time pressure. We have to finish these many patients. Like just now, I have finished my OPD in a very short period of time because I have to deliver a lecture and there is a lot of time pressure. So we are continuously under stress. That has become the biggest stress nowadays. Commuting, that is another stress. Like going from Pune to Pimpri is a very daily routine for me, but it is very stressful also. There is digital overload. That is another stress we are going through everyday life. We get so many messages, so many things to do, and we feel like we should be active. We should be attending webinars, we should be attending lectures, we should be responding to the groups also. But then that leads to a lot of stress in our life. And we feel like we have to be available because when we get some message from patient, sometimes we feel like if I don't respond, then I might lose patient. So this keeps on adding to our burden and it leads to emotional exhaustion. For doctors, it is not about survival anymore. It is about balancing endless responsibilities. Attending emergencies, updating on EMRs, and responding to patients on WhatsApp messages. Responding to WhatsApp messages also has become so difficult that sometimes we miss something and then we get the call from the patient that we were telling you that this is happening and you didn't respond to us, and then there is blame and then there is defamation. So there are so many other issues that keep on disturbing us, and that leads to a lot of stress. We are still trying to maintain our personal life because we have family also, children, spouse, and then it becomes another stressful because they are not used to that, and then children especially expect a lot from parents, and then it becomes stressful for the practicing doctors these days. Our stresses have evolved in last few years from the physical threats to the psychological ones. Why this is important? Because in modern stressors, there is increasing burnout, anxiety, and depression. There is increase even in the use of substances in our life, and to overcome, like as sir said, that we increase our consumption, coffee consumption, just to overcome the stress. But sometimes it adds to the substances also. Studies have shown that doctors have higher rates of anxiety and depression than the general public. And also, there is a increasing stress of substance use among the doctors. Studies also show that there is emotional exhaustion and reduced sleep in most of the professionals. So, understanding how these stresses affect us is the first step in preventing the burnout and maintaining our mental well being, something we often neglect. We feel like it is okay, I am fine, till we land up in the crisis situation. Social media has become a trap for us and for the society itself. It has become a bigger stressor for doctors because patients are so much aware about their health related issues. Like they are more aware. Like when they come with the report, they have already read so many things. They know what is the possibility, what other tests will be advised, and everything. So when we see our colleagues, that is the stress, information overload for the doctors and the patients. So that has become one of the most uh, stressful factor for the doctors also. Another thing is our colleagues. When we see our colleagues posting their pictures, conference talks, research papers, vacations, we also start comparing ourselves subconsciously. We start comparing, and that adds to our problems in life. Sometimes there are people who publish so rapidly, then, especially in medical colleges, it becomes very competitive. Like someone has published more papers, then they will get promoted quickly and all. So, when you see all these things happening in front of you, you start comparing yourself, and there is a trap. People compare real life with others, and they start feeling like they are not doing enough, they are not good enough, and we start feeling that, and that leads to the problem in our life. Social media, especially FOMO, the fear of missing out, this term is very common these days, that we feel that we must attend every conference, We should also keep on going on vacations, join all WhatsApp groups, and respond especially to all these groups. Follow every CME. And if we don't do that, we feel like we are falling behind others. It creates anxiety that we are missing out something. And even during holidays, seeing others post about trips, workshops, we feel guilty. Instead of resting, we start comparing and doing something else. So instead of recharging, we stay restless and we feel like there is always need to be connected. So we are, instead of relaxing, we are trying to be available on the social media platforms. Cyberbullying is another problem. Doctors today also face digital criticism, like negative reviews, angry tweets from the patients about dissatisfaction online. This leads to a lot of distress to the doctors. Even one harsh comment on the Practo or Google platform can linger on our mind for days. This form of online hostility is not good for the doctors. It is emotionally draining, and we rarely talk about its psychological impact. So, this is the social media as a stressor, and there are other problems like where there is information overload. If you want to read something, previously people used to refer to the standard textbooks, but these days there is so much of information that we end up scrolling so many things, so many websites and reels, and this leads to the problem like we are deprived of sleep. There is too much of stimulation to the brain. Many even experience the phantom vibration. Phantom vibration is when people feel like their phone is buzzing during the rounds when it is actually it didn't. So this is something new that you feel like the phone is getting vibrated or phone is ringing. This is how our brain gets conditioned and we become dependent. Social media initially triggers the dopamine release like an addictive substance. Initially there is excitement, so we keep on checking whether we have got any new message or anything, but it reduces our attention span, it disturbs our sleep quality, and even during in patient interaction we focus sometimes on the instead of patient we focus more on the phone, so this hampers our rapport with the patient. Dopamine release also leads to addictive like behavior, and this is commonly seen in the children these days. Okay. So, young children, their brain is getting stressed very easily, and the dopamine release leads to the problems like mobile phone addiction, internet addiction, reel watching addiction. This is very common in new generation. Gen Z, especially, we will see that they are having all these kind of problems. Technology has made everything faster. Life has become very fast. So, though it is very fast, though we feel connected, actually we are not connected to anyone. It is a very superficial connection. We we are constantly available through the calls and text and teleconsultation. There is no real off time. We this chronically getting connected to the phone, being available all the time, even during dinner, patient may call, send some reports. If we don't check within few minutes, they will call and tell that I have already sent you report, please check and let me know. So all these things are happening these days. Multitasking, I heard doctor was telling you about multitasking, and there are too many things that we do at a time, right? Everyone is doing, and we feel like if we do too many things at a time, we are doing it very fast. But actually, if you do one task at a time and focus on that, it is sometimes more satisfying, and you are giving justice to that act also. We multitask constantly physically. We have so many long sitting hours that leads to another problem like obesity and cholesterol related issues. Screen time has also increased, and so screen strain is another problem. There is lack of movement, and constantly sitting at one place can lead to the problems in life. There are problems like neck pain, back pain, and we are taking many young children also nowadays suffering from all these types of problems. Like they suffer from problems of spine. So ironically, we treat stress related disorders, illnesses in patients daily, but often ignore our own well being, and we end up in having digital fatigue. Sleep is also delayed, as everyone is aware that when there is excessive stimulation by electronic media, especially phone, computers, television, the sleep onset is delayed. So though we feel like we are socially connected, we are socially superficially connected. There is no touch, there is no reciprocity, and usually everything becomes like we have many friends online, but in real life there is lot of loneliness. So this has become a problem of new generation. Another problem of these days is substances. With all this pressure, some unconsciously turn to the substances to cope the stress of life. Alcohol after a long shift, extra caffeine use to stay awake during the nights, or sleeping pills to unwind yourself is a problem. It starts as a harmless use, a glass of alcohol or a glass of coffee, strong coffee, after work or after rounds has become a common phenomena. But gradually, if you keep on doing this daily, this will lead to the daily consumption will lead to the habit. This forms a stress substance cycle. We use substances to relax, but we end up using it so daily that it leads to the disturbance and you start getting the symptoms of addiction. Like you have to take the substance. If you don't take, then you feel like you are doing something which is the body is demanding, but you are not providing. So gradually you become addicted. Among junior doctors, we also see the overuse of stimulant drugs, especially during the exams or duties, and which can affect their health in long run. Then there is these stressors, they have an impact on your HP axis and it leads to actually worsening of the stress. Instead of helping, substances are known to cause the worsening. Vaping has also become very popular, especially in young generation. Vaping is very common and they think that that is not a problem, but actually vaping is very harmful and it can lead to dependence of nicotine dependence, and it is very easy to use, so people use it very casually. They can carry it anywhere. Social media and technology, these are the stressors that don't exist separately. They feed each other. So scrolling social media often after night duty, it usually leads to sleep loss and this makes the work harder. Fatigue increases and this is a continuous chain. One affects the other. It is a chain reaction. Young doctors and residents are most vulnerable because there is peer comparison, fear of underperforming, and long duty hours. Even among consultants, the expectation is to be always available, both online offline, and this increases the stress. Adolescents and younger adults, especially they are youths, residents, they are very vulnerable because their brain is developing. There is identity formation and there is fear influence. There are cultural differences also. In some societies there is individualistic approach and then it becomes protective and therapeutic perspectives. I think Dr. Shah sir told us about having at least one hobby, right? So there are some healthy coping mechanisms. Healthy coping mechanisms in especially physical activity. I heard that sir told us about have good hobby and it's especially the physical activity. Physical activity is known to release certain substances and that gives the energy, enthusiasm, and so physical activity is, if you have the hobby like playing cricket, badminton, and that gives both physical activity as well as the hobby also. So then it becomes very useful as a healthy coping mechanism. Digital hygiene is important. We have to take the break. We have to set the limit. We have to limit the time for checking messages. Actually, if we can train our patients that I will be available online for this much period of time, So if you want anything, any response from me, I will be available in 1 hour in the morning, 1 hour at the night time, and so I will be night means evening time. So I will be available, and I will be responding to you during that time. That is very effective, so that we can avoid the calls after certain hours. Unless urgent, the patient can text and wait for the response from the doctor. It is important to set the boundary, because we also should have some personal life, right? Apart from our professional life, we should have personal life. So we can keep the separate phone or separate WhatsApp account for our personal life, and for our professional life, we can have another account that can also help us to decide which phone we can continuously use and which we can keep off. Then we should be able to rest without guilt, because that has become a problem. Okay, if we can rest without a guilt, then that is a real rest. It is okay to switch off your phone, it is okay to take the leave, and recovery is a part of productivity. So if we can look at this as relaxation, then we can uh, be taking the rest without getting disturbed. Recognize that the signs of burnout. Sir has told us about honeymoon phase and then how it progresses, early signs of burnout. Okay, so if we can recognize the early burnout, we will be able to identify that we are going through a stress which is beyond our capacity and we need help. If there are early signs like irritability or sleep issues, it is better to seek counseling and therapy. It is good that we are able to acknowledge our symptoms. So it's not the weakness to seek a help of a psychiatrist or a psychologist. Workplace also creates a lot of stress. Those who are working in a structured shifts, or those who are working in government setup or in medical colleges, there is a lot of competition and stress at these places also. So encourage building a peer support system. There has to be a time where you will be able to rest also. As doctors, if we care our own mental health, the patient's care will be automatically improved. So early identification of problematic use and intervention at right time is the key. So to conclude, modern day stressors like social media, technology, substances are the parts of our lives. They help us to stay connected, informed, efficient, but when used without limits, they drain you emotionally. For doctors, the pressure to do more and be available all the time is immense. But the truth is, balance and boundaries are as important as medical knowledge. Technology should work for us and not control us. The key is mindful, moderate, meaningful use, both for patients and ourselves. So, if we can use it, is a double-edged sword. It is useful also, but it can lead to it can create problems in our life. Thank you.
Very well said, ma'am. Technology should work for us, not control us. So very well said that in our practice, many times we forget lot many things, and we more focus on practice, and without what we should do for ourselves. And you very well said that about FOMO, cyberbullying, and we are digitally overloaded. Truly, we do get lots of messages, lots of emails, and it's very difficult for us to answer all those things in our daily life. We are giving our mobile numbers to the patients, and they bother us at many times, and really it makes our life more miserable. We should definitely give time to ourselves, our profession, and our family also, which is equally important. Screen strain is you said very nicely. Sleep is very much neglected many times. We should maintain digital hygiene, and that's very much required for at least medical professionals. If we follow all those rules, then it would be of a great help. Sarika, can we take question and answers?
Yes, sir.
Uh, uh, there is a question for ma'am. How to treat mobile phone addiction in children and adults? Can you throw some light by Rajendra
Well,
Purohit?
yeah. Mobile phone addiction has become very common. Is one thing is like we give mobile to children at very early age, though their brain is not developed. But we start feeding our child by showing the videos. Okay, that is the early stage. By 1 year or 2 year, I see my niece and nephews are feeding their babies with the mobile phone, and there is a video on. And when they look at the video, they only start eating the food. At that early stage, we are exposing our children, grandchildren to that. So it is known that it is the addiction caused by mobile phones or screen reels or YouTube media is as getting addicted to substances like alcohol, nicotine. Okay, so that gives us sudden dopamine, and it acts like a same stimulant. So while treating, as we treat addictions like alcohol or nicotine, first thing is like it is de-addiction comes with problems like it is easily available first thing, and the way you can do it is like firstly internet should be off. Okay, that is also a big problem because our life runs on internet, right? So uh, keep taking phone breaks, gradually reducing the use of phone, and then uh, usually there is no other treatment as such. Like there is but you can see that the children getting very irritated if you take phone away, and even adults, if it is like becoming a very much problem, then people are getting admitted also for the mobile phone addiction, reel addiction, YouTube addiction. But mainly you have to stop using it, keeping it off for some time, gradually reducing the use, stopping the internet access, keeping mobile switched off at night time. These are the measures you have to start, and gradually you have to keep on reducing the use of mobile.
So I think if the whole family follows the digital hygiene, then maybe they
Exactly.
will send a good
So,
message.
so if you start showing the child mobile phones for feeding at so early age, from that age, if the child is getting addicted, we see the memes also on our WhatsApp, like the baby is holding a phone, like in utero also, right? So these things are becoming very popular. So we have to overcome this. Firstly, we have to train ourselves so that we can train the next generation.
Right. So in general practice, how they can because now there is a DSM-5 criteria is also there for digital addiction. So,
Right.
but in general practice, I think it would be very difficult for them to handle such people. I think experts would be required for such things. What do you say?
Yeah, they will need experts, but at the primary level, they should be able to tell and educate the family members, parents especially, and the parents should follow the rule themselves. Then only they can teach because parents are looking, most of the times, I see that marital discord is because of the excessive phone use by the spouse these days. That the husband comes home, but he's on the phone all the time. He's not helping or taking care of the children or doing something. Okay. Even females also. I will not make this comment from male female side, but it is both ways. So if we can manage or if we can control ourselves, we can teach others, right? So we have to start with ourselves first.
Right, ma'am. Dr. Sandeep, there is a question: how to deal with depression, overthinking? And Dr. Mridula Sharma has asked these questions.
Yeah, thank you, Dr. Himanshu. Say, overthinking is one phrase which everybody uses when they come and talk to psychiatrist, when they think of the same thing for multiple times, and I think they are trying to define that as overthinking. Let us not link depression and overthinking. Depression has its own symptomatology, and we should be able to clearly diagnose depression from the DSM-5 or 5 TR criteria, like the duration of 2 weeks, feeling low or irritable, and then having appetite disturbance, sleep disturbance, weight loss when not dieting or when not trying to have weight loss, sometimes hopelessness, helplessness, and then you know there is a chance that a person starts thinking of ending his or her own life. Better if I was dead, and then there are suicidal ideas, suicidal contemplation. So this is clear-cut depression. Whenever a person comes and talks about overthinking, usually I try to explain to them that everybody has X number of or N number of thoughts coming in 1 minute. Nobody is thinking more than that. But when from those 100 thoughts, if for 90 thoughts you have the same thoughts, then you feel that you are overthinking. And that is why you have to plan. If you are not depressed and you are just bothered by what has happened, you have to plan to live in the future, you have to plan tomorrow, you have to plan the next moment, and that is how you can handle your overthinking in a easier way.
Right, this side. Ma'am, can you answer that? Do you think the negative dreams result in depression? If so, then how to manage and what type of prophylaxis measure to be taken? Negative dreams results in depression? What do you say?
Mm, Definitely. But when you are depressed, you may get negative dreams. When you are anxious, you get the dreams of some anxiety, like you are not able to catch the train, or you have gone to the exam, but there is a different paper. All these dreams are very common. They represent anxiety. But negative dreams may not lead to depression, but the depression may be pre-existing, and then you start getting negative dreams is the possible more possible.
Okay. Dr. Sandip, there any difference between burnout and depression? Dr. Lokesh is asking.
Say what happens when you are stressed, and if you are not managing the stress, then the stress keeps on building, and then even for the slightest or the minutest stimuli, you will react. That is one way stress starts accumulating, and then you lead to burnout. So that's a whole different symptomatology than depression. Again, as I told, depression you need to diagnose as per DSM-5 criteria, and there are very clear-cut criteria for that. Burnout, on the other hand, if you start knowing the stressors, if you start knowing your own reaction to the stressors, how you are giving importance to the stimuli which is causing the stress, and not handling your own stress rather than you are giving more weightage to the stressors or stress causing stimuli, then that is where burnout is going to happen. That is why I told that sometimes you have to learn to live with the stress, you have to adapt, you have to cope, but it is not like, everyone knows one day I am going to die. It is important to live like you are living this moment to the fullest. Then it is all right. Otherwise, everybody has chest pain and everybody has body ache and everybody feels that, oh, I am doing a lot of work. But if you are doing work, and if you are doing work as per your need, as per your requirement, as per your specifications, then you are not going to be tired. But if you are doing work, as madam told, residents, you are doing work under somebody, you are doing job, and you feel that no, I am from 9 to 5, I am sitting 9 to 6, this is overwork, and now I cannot handle this situation. That is how it starts making you stressed. So, depression, there is a clear line between burnout and depression.
Dr. Dinesh has asked about any platform for primary care doctors for medical health, for mental health. I think on Plexus MD or Medflix, there are lots of videos are available related to mental health disorders. So you can go through this platform, and there are channel by Dr. Suresh Badamat, and he has also on YouTube, and there are lots of videos are available by Dr. Suresh Badamat, and there are a lot many videos are there by all of us, all mental health professionals on YouTube. So you can go through all such videos by mental health professionals, and that can be of a good help. Any suggestions from your side, ma'am or Dr. Sandeep? Any platform are you aware? I think on Medflix there are lots of videos are available.
Yeah, even for the primary care practitioners, it is important to understand what are the commonest mental health related symptoms. Try to identify them, talk to the patients about those things, and try to talk with your professional or have a professional reference, and then put them, even if required, on medication in the right dose so that they start responding. For you to learn, it is best to learn the symptomatology, and what would clearly identify or differentiate between the symptoms being caused because of a mental health issue and anxiety rather than the symptoms being caused because of the underlying organicity. And at a family health or a family practitioner level, you are seeing those patients for a very long time, as good as family members, so you know about a lot of history, which also may be responsible and which may help you easily diagnose these things. So very simple symptoms in mental health, the commonest mental health issues and the symptoms would be enough for you to learn about how you can identify mental health problems. Treating about these patients would depend on the specialist or the professional, and it is good to have a consultation with the professional and define whether the person needs to be on medication or the person needs to go on to have some therapeutic sessions, or he needs or she needs both the things. And that is how you can learn about the platforms or the mental health issues. Otherwise, as Dr. Himanshu has told, there are n number of videos available on YouTube, like Dr. Suresh Badamat, and you can identify the problems or the mental health areas where you want to work, and you will have all those things available. Only thing is, you should trust those YouTube videos which are by professionals, so that will become easier.
On this platform also there are a couple of videos are there, and which we have acted some of the disease, and we have shown that these are the symptomatology. You can go through it, and that would be real. You will be able to see the real patients, and that is of a good help. We have developed a program, Psychiatry in 1 hour, in which we show almost all disorders, major disorders, and we are doing acting for those disorders. And you will have a feeling of real patients, and you can start treating these patients. It's not that difficult task, but you can treat the basic things, because we are in a very less number. So if you'll start working,
Right.
definitely you'll get more and more patients, because they are moving there in the society, but they are not coming to the door of psychiatrists. If you'll
Right.
start picking up those patients, definitely it will be of a good help for all of us. What do you say, ma'am?
Yeah. Exactly, sir. Because there is the demand and supply is not adequate, but because there is a lot of demand for the psychiatrist and we are not able to cater the services to all the patients. So if they can identify the symptoms at early stage, or if they can diagnose illnesses like anxiety, depression, schizophrenia, means psychosis, and if they can start treatment at early age, then it will be possible. Or at least one consultation with a psychiatrist and the follow up with primary care physicians is also a good idea. Like internationally, when we see in especially in United States, where the consultation of a psychiatrist is once in a while in early stage for diagnosis and to write the plan, but the follow-ups are done with the primary care physicians. And when there is any problem, exacerbation of the symptoms, then the second opinion, or means the psychiatrist will be seeing the patient again. So if you have already acted and made some videos for them, that is really a good task.
Uh, and my suggestion is, you can make friend to any one of us, and you can call us at any time for
Right,
any questions you get. That would be of a good help also.
right.
There is another question, that being a professional, ma'am, being a professional, how to draw a line when being very empathetic with a patient who is dealing with some mental trauma? Being a professional, how to draw a line when being a very empathetic with a
Sometimes,
patient
yeah,
who is
it's
dealing
very
with.
difficult to maintain the empathy when the problems are similar to your life. Then you become more, there is a chance that you develop a transference, and there is a problem. Transference is when you feel like emotionally you are also getting losing the boundary, and then it becomes really difficult. But you have to always remember that you are here to help and not to get carried away by the patient. So you have to continuously keep on telling yourself, and you have to maintain that boundary. And when you feel like you are developing some positive emotions which are not good for the treatment, you have to become alert and start identifying it. And if you feel like this is going in spite of your being aware, if the problem continues, then you have to consider the sending patient to another doctor. This happens sometimes, especially with any doctor. It can happen with a male doctor also. It has happened in the past. In female doctors also, it happens. So you have to be very clear, like when you are becoming excessively empathetic and losing that boundary. So that time you have to take the different step.
And we are watchful about our own emotions also, so
Right.
at least we can be into that boundaries. Very true. Someone has asked about the same things, that keep how to keep our children from mobile for its long time use and make the child highly
I
recommended.
will, because I have raised three children, so I know that if you have to keep the children away from the mobile, you have to give them alternatives which are useful
Exactly,
for
more
them.
effective than mobile.
Yes. And for that, you have to spend time with children, which we can't do. That is our problem.
So if you spend more time with your kids, I think they'll be away
And
from the
the
mobile.
stimulation that they get from the mobile, if we can provide that level of stimulation from the physical activity, if we ask them to get involved in the physical activities where they can use that energy positively, and if that body develops that trend, then it is possible to keep the children away. Like outdoor games, get playing some games like chess, or where they will develop more intellectually and emotionally. That will be very useful for the children.
Right. Dr. Sandeep, someone has asked, Dr. Payal has asked about causes of ADHD and autism in children. I think this is a deeper topic, but if you can answer in a brief, cause of ADHD and autism.
So, Dr. Payal, see, causes of ADHD and autism, you can write a textbook, meaning they are not very clear. There are a lot of genetic jargons in it. There are a lot of inheritable issues in it, and there are a lot of developmental issues in it. But if you look at the recent guidelines, we have classified autism into developmental disorders rather than mental health issues only. And by that, it means that it is a kind of disability. And when we say it is a kind of disability, it's a thing which is not only an illness. And a lot of work is required with these children so that we can take care of their development till they start maturing or becoming adults. Does not mean that they start becoming as normal if they have serious problems. As far as ADHD is concerned, yes, there are so many ways of managing ADHD in children, and definitely we see a ray of hope once they become adults, because we see a lot of ADHD children becoming near normal by the time their superego develops, and by the time of 15, 16 years, sometimes it is a limiting illness where they start functioning normally. Though many a times it can also go to become an adult ADHD, right?
Sanika, I think I've answered. I mean, seen all the questions. I think there is no more questions.
All questions have been covered. So if there are any more questions, you can let us know, and then I can share it with the faculty and have them answered in a while later.
Right.
But in the meantime, we just if there are any closing remarks from all three of you, one parting message for the audience. So we can start with you, sir, and then
Uh, as I've said, that early intervention by primary care physicians are very much required. If you start picking up those people who are moving in the society, then it will be great help to them personally and the families and to the society. So find out the patients who are moving in the society, pick them from the early phase. Then you'll prevent them to become a chronic patients, and it will be of a good help. Start picking up those patients. Dr. Sandeep.
For me, when I've talked about stress and burnout, it is very important that all of us should start looking at identifying the factors where we are stressing out, not handling the stress properly, not taking one day at a time. Learn to live life in a way which is relaxing, more pleasant, and also consider the emotions of our own family members, look after their needs, because most of the time, as madam has also told, their needs are superseded by needs of the patients for whom we are available 24 by 7, and many a times for the family we are not available 24 by 7. We are hardly home, like we are in a hotel. So that is very important, even our own experiences for that matter. So it is important that you learn to live life in a way where you respect yourself, your mental health, your physical health, your emotional health, your spirituality, grow in it, and you will see that the rest of the family also grows with you. And that way you can also have a good resilience towards burnout, because stress is always going to be there.
Ma'am.
Thank you.
Yeah. Social media is going to be a part of our life in future also, and I don't think we will be able to cut it down, but we have to use it judicially, and it is though really useful sometimes, but overuse is not good. To cope the stress, substances is not the solution. To cope with the stress, we have to use the alternatives like healthy coping strategies, exercise, developing hobbies, having good lifestyle, and so that we can have a happy life. So social media is though useful, it should not overpower you or it should not take over you.
Thank you, ma'am.
Thank you.
If you can read it.
Yeah, your voice is.
There's one last question comment that has come.
Ma'am, you'll have to answer. While dealing with patients, seeing their pain and other health and family issues puts a lots of negativity on professionals. Also, what should be we always keep in mind while dealing with patients, such that our mental health do not suffer.
एक मिनट हाँ. Okay. See, when your mental health is getting affected, then it is a problem because you are a treating doctor. Okay, it means you are losing that boundary where you feel like you are also part of family. The empathy is where you are in a position, in a as if position. Okay, so I am very much aware that we also get affected. Okay. It is not that like we are sitting and we are all the time maintaining our mental health and not getting affected or not getting, because these are the negative vibes and that do affect us also. Okay. So if you are over empathic, if you are extremely sensitive, you are likely to get affected with each and every patient. But you have to develop your own self in such a way that you are here to treat, and it is possible that you won't be able to treat everything. Okay, so we have to accept few things like it is going to harm you also at times, but when you feel like it is going beyond your capacity, when it is affecting you too much, when it is disturbing your sleep, when you are becoming more irritable or getting fatigued, exhausted by your physical, by your professional work, then these are the signs of your burnout. Then you have to take a break, handle your emotions first. You are the one who is going to treat yourself and the patients also. So the doctor who is mentally fit himself will be able to treat many more people. So I think whenever we feel like we are losing that capacity to manage ourselves, we have to take the break and take rest and help ourselves first.
I'll add that we should develop our own resources to fight our daily stresses of our life.
Right.
You
Yeah.
should start meeting our friends very regularly, and as ma'am has said that we should take frequent breaks with our people whom we like to move around, and
Right.
that's the key, I think, for our own mental health well-being. Dr. Sandeep, your say for this thing?
Yeah, it is very true, because that is why, I have always been seeing from the other perspective that we should learn to live our own life. And, that is the only, what we say is a kavach, which is going to protect you from transference of the negative emotions. It is not that the negativity keeps on transferring, because there are so many things which do not improve, do not change. The mother-in-law is not going to change, the daughter-in-law is not going to change, they are all going to stay together. The boss is not going to change because the person cannot leave the job. So there are so many things which are going to be there, and we have to take it as a matter of fact. And that is how empathy plays a role, that if we can be more empathetic, then these things will affect us less. But we do need to understand when it affects us, we should also try and have enough resilience, enough power, enough time to build the resilience and bounce back.
Take a break. Otherwise, if you cannot manage, see us.
That's better, yeah.
Thank you, Sanika.
Thank you.
So thank you so much for each one of you for coming on the platform and answering so many questions, as well as delivering a wonderful talk on important topic like this. Uh, we have a lot of comments for each one of you in the comment section that have come in as a thank you for the session and an appreciation for this talk. So thank you so much once again.
Thank you,
Thank
everyone.
you.
Thank you.